we've come quite a ways in the past few years with just single agent immunotherapy. And now the next horizon and the next frontier is what I call IO, or immunotherapy combination mania, or combo mania. As a dedicated thoracic medical oncologist, I can't keep up with how many different strategies are being looked at. But some of the ones that are being looked at, of course, that are well known to a lot of us, is looking at immunotherapy in combination with chemotherapy, and there's some compelling data coming out looking at pembrolizumab in combination with carboplatin and pemetrexed. There are IO combinations that are being looked at, OX40 agonists in combination with immunotherapy, IDO inhibitors in combination with immunotherapy, and then looking potentially at targeted therapies in combination with immunotherapy. And it's the wild, wild west. There's a lot going on. There's a groundswell of clinical trials being done right now that I certainly can't keep up with. I try. I think we'll have to wait and see how the dust settles here, whether all this will pan out or not. I think it's important that community physicians are aware. For now, immunotherapy is approved single agent up front for those patients with a tumor proportion score greater than 50%, and then in the refractory setting for both adenos and squames as single agents. Combining it with chemotherapy, we don't know. Combining it with other IOs, we're not sure. We'll have to see. And again, I've said this in this interview before, you bring me back 6 months from now, I may have a very different story to tell.